The demand for weight loss drugs like Ozempic and Wegovy has skyrocketed in the past few years, despite the high cost and unpleasant side effects for some people. But now the New York Times reports some patients are finding a way around both of these concerns by experimenting with microdosing the drugs. The idea is to take a smaller than recommended amount, about a tenth of a standard prescription, in order to stretch the supply, reduce costs, and potentially curb side effects. But some health experts are warning this practice is untested and needs to be closely watched. For more, let's bring in Dr. Jeremy Faust. He's an emergency physician at Brigham and Women's Hospital in Boston. Doctor, thank you for your time. Before we get into the risks here, potential risks, is there any evidence that microdosing these medications is an effective way to lose weight and skip the side effects? How does it work?
Thanks for having me. Here's what we know. These drugs have been tested for a long time, and the doses have been worked out very carefully in all of these phase 2 trials that led to FDA approval. And for that, they are remarkably effective in terms of controlling obesity and then all of these other things we know about now that are just changing the landscape: cardiovascular disease, kidney disease, all kinds of problems that we'd love to get a handle on. And these drugs seem to have a role in that. What we don't know, as you say, is what happens when you take those doses and slash them by a lot. But we have some idea that it might not work despite these anecdotes. And the reason is that early in these trials, the manufacturers are looking for that right dose. And what they find is that lower doses don't have the effect that they're looking for. And they actually compare to placebo to low doses, and they look about the same. It's only at those higher doses that you get those sustained benefits that everyone is so interested in.
But I also know that there's not a lot of trust in some of these companies. We know, for example, that they're selling these weight loss drugs for much lower costs in other countries. That said, what are some of the possible downsides to microdosing these medications?
Well, I want to acknowledge what you said about the distrust, because there are sometimes these studies where you have to squint to see what it is they're talking about. But what impresses me about this class of drug is that every time we see a new study, you open up that paper, or I do, and I see the data, and it's not being gamed. It is just so slam dunk that it's not like they're slipping a fast one on us, which is really great, right? But in terms of whether or not this would harm somebody, the real harm that I see here is that you won't get the benefit. We know for a fact that if you have a much tinier dose, you won't have the same side effects. We know that. But you also don't get the benefit. And people want to know, am I getting benefit, and am I getting something that is safe? And so I think the harm could be that someone's taking something they think is helping. I'll give an example. If you were to travel overseas, you might be recommended to get a vaccine so that you don't get a pathogen, a bacteria or something else that's really dangerous to us that we don't have here. You do not want to go on that trip having received a microdose of that vaccine, because you don't know if it works. Now, you may not get infected on that trip, and you might think, oh, great, it must have worked, but that's not really how science works. We know that we have to see big data and really well-done trials to see the effects like that.
Do you have fears, in addition to patients not seeing the benefit, of any potential risks or downsides to patients essentially taking it upon themselves and giving them whatever dose they feel?
Yeah, that's a big problem. And what's happening is people who, when you read about in these stories, they are people who had real trouble with the regular doses of these drugs. And we need a place for those people. And I think that we should study those folks and figure out maybe there is a different dose strategy for them. But what we're hearing about in these anecdotes and these fad sort of rumor stories is that nobody really knows what they're getting. And so they're going to these compounding pharmacies to get doses that have really not been vetted. And so they don't really know what they're getting. And what's so amazing is they might think it's working, because, again, in these trials, remarkably, we see that people who get placebo, they lose weight at first. It's a remarkable thing we see over and over again, but it takes time before the drug starts to really outperform placebo. So people might think they're getting something good, but in fact, they're not. And it's not just about a few pounds, by the way. A lot of people who are taking these drugs are getting a cardiovascular benefit, a mortality benefit. And it would be really bad if we told people that they were getting a drug that they weren't getting the right amount of to get those benefits.
Well, Dr. Jeremy Faust, really appreciate the conversation. Thank you.
Thank you.